This lecture will be on the history and physical examination of the head, eyes, ears, nose, and throat, also referred to as HEENT. We will focus on the head, ears, nose, and throat in this lecture, with the following lecture focusing on the eyes. The objectives of this lecture will be to describe the anatomy of the eyes, ears, nose, and mouth, and throat, analyze the health history and physical examination specific to the head, eyes, ears, nose, mouth, and throat as it relates to pediatric, adolescent, adult, and geriatric populations, and differentiate common health problems affecting the eyes, ears, nose, mouth, and throat. The lecture will be presented in a head-to-toe fashion, focusing on the normal anatomy and physiology, and then reviewing relevant subjective and objective data used in evaluating each of these systems. The final discussion of each system will consist of reviewing some of the more common abnormal findings. Some of the common questions a healthcare provider asks each client when performing a history on the head include: is the patient experiencing any headaches? Has there been any history of any head injury? And if so, when? How frequent and to what extent? Is there any dizziness? Is there any neck pain or limited range of motion of the neck? And are there any lumps, bumps, or swelling of the head noted? Any affirmative answer would then result in a complete assessment of this system using the old CART anagram to guide you. When inspecting the head, the nurse practitioner should inspect and palpate the skull for symmetry, bumps, lesions, alopecia, and infestations. Inspect the facial features for symmetry. The nurse practitioner should check the neurological function by testing sharp and light sensation of the chin, cheeks, and forehead using the tip of a paperclip and a cotton ball, assessing the trigeminal nerve, cranial nerve 5, and the facial nerve, cranial nerve 7. Palpate the transmandible joint to assess for TMJ, which should be assessed by placing your hands on the TMJ area and asking the patient to open and close their mouth. A normal finding will result in no popping or clicking palpated. Palpating both the maxillary and frontal sinuses for tenderness should be assessed by tapping on the cheekbones and above the eyebrows respectively. If tenderness is appreciated, the provider should check for transillumination using the otoscope and pressing the lighted speculum on the maxillary area or underneath the eyebrow. Patent sinuses would result in the illuminating of the skin in those areas. The provider should inspect and palpate the neck for any tenderness, crepitus, or lumps. Asking the patient to perform passive range of motion of the neck, noting for a full range of motion and no pain should be done. The provider should assess for flexion, which is having the patient touch their chin to the chest, extension, which is asking the patient to look up at the ceiling, rotation, having the patient turn their head both to the right and left, and lateral bending, which is done by asking the patient to touch their ear to their shoulder on both sides. The provider should also assess and palpate the lymph nodes of the neck, which include many different chains. This picture helps show the different lymph nodes that are assessed during the assessment of the neck. The preauricular, which is in front of the earlobe, followed by the postauricular, behind the ear. The parotids at the lower ear tip, the tonsillar lymph node. Submental is under the chin. Submandible lymph nodes are at the corner of the jaw. You have occipital lymph nodes at the base of the brain, followed by the superior cervical lymph nodes, deep cervical lymph node chain and the posterior cervical lymph node chain and supraclavicular lymph nodes that are above the clavicle bones. The nurse practitioner should also palpate the thyroid gland, assessing for symmetry and absence of any nodules. The practitioner should also assess for bruits in the carotid arteries using the bell of the stethoscope and listening for them.